Ready.
Good morning, everyone. Today, Pharmgree Pharma 4.0, Dr.MGRERI Medical University Faculty of Pharmacy, conducting such an international conference on transforming the future healthcare by innovation technology. First of all, I congratulate the medical Dr.MGRERI Medical University as well as all the speakers, delegates, and the management, chief patron, co-patron, and the vice chancellor, registrar, and the principal, as well as all the faculty members, that organizing such a great event mainly on emerging technologies with respect to healthcare. And my sincere apologies that in the last minute I was not able to attend because of some compelling reasons which I was not able to avoid. My sincere apologies that I was not able to be there, and my sincere warm greetings to the today's chief guest, Dr. Mantu Patelji and Dr. Ravi Kumar, the WOCAD Research Center, and all other the speakers and dignitaries. Warm greetings to everyone. And today, if we talk about the theme of the conference, India is the pharmacy of the world. Everybody knows that India is a pharmacy of the world in terms of the quantum of medicine manufacturing, medicine distribution. Almost we supply medicines to all the countries. You can say 100% all the countries in the world. It starts from basic, the essential medicines to specialty medicines. We have medical devices, vaccines, veterinary medicine, and so on. So it's a huge area, and India is almost, we can say it's leading in that. But there are certain things which also we need to consider. There are a lot of challenges which we need to consider. For example, even now the availability, accessibility, and affordability of medicine, if we talk, it is a challenge. For example, we can get the food in 1 hour through online various platforms, but whereas getting medicines during emergency is still a challenge. There is a difficulty. So here we can say that the latest technologies can be one of the biggest support, and the future world is going to be technology driven, and even the present world is technology driven. When we rely so much on technologies now, there are many advanced technologies like big data analytics or artificial intelligence. These kind of technologies can bridge the gap, especially with respect to availability. Just imagine India is a pharmacy of the world, and in some corner of the country somebody is losing his life because of availability of medicines. In a place it is surplus, and the other place it is not adequate. Same way, if you go to these accessibility, accessibility is also an issue due to various physical condition and geographical economic conditions also. For example, somebody is having money, they can get all the high-end treatments, whereas somebody who is poor and not even able to get the basic medicines, again that is also a challenge. Though we claim that we are leading, but still there are challenges within the country, and whatever the issues which we are talking about, it is not the country of India alone. These issues are global. Again, affordability. If you go to the affordability factor, if we talk about out-of-pocket expenditure means how much a family spends from his own pocket for the purchase of medicine or healthcare. In that particular out-of-pocket expenditure concept, Indians spend almost 50%, 50 to 60% from their pocket, which means though we have a good healthcare system, our cost of healthcare is very high. So here also we need to think that how to reduce the cost of expenditures. That is also one of the very important area where we need to focus. Even within the healthcare expenditures, if we see the expenditure due to medicine, it is more than 60%, which means if somebody visits the hospital, even it is government or private, each and every patient is spending lot of amount mainly on the medicine and health expenditure. And but it should be the other way, because health is a state subject, and as well as if you go to European countries and all, most of their health expenditures are covered under the insurance. Due to poor coverage of insurance in India, and the poor we are not much aware of the healthcare insurance facilities, as well as the Indian people are not prefer healthcare, the healthcare insurance schemes. That is also one of the reason. Government is taking a lot of effort, for example, to bridge all these gaps. If we take availability of medicine, accessibility of medicines, and the even affordability of medicines, India is having, we have PHCs, CHCs, as well as in everywhere there is a free medicine schemes, and there is the Ayushman Kendra, which is opened in throughout the state in very huge numbers, where we can get the generic medicines at very low cost, the high quality generic medicines at low cost. And also the government is focusing on Ayushman Bharat scheme, where the insurance coverage, government is pushing for the insurance coverage. Each and every family will be given 5 lakh rupees per year, per annum, for the health coverages. So these are all the various efforts government is taking. What I want to tell all the delegates here or the participants of the conference, though government is taking a lot of efforts, only the government efforts alone cannot be the determinant, or it alone cannot solve these kind of bigger challenges. For example, India is the global pharmacy. Still we are dependent on raw material for China. Same way our supply chain mechanisms, which are not technology supported, from the raw material aspect, still we need a long way to go. When we go for manufacturing facilities, yes, even there are a lot of challenges we face due to compliances, whether it is WHO or any other global standards. Always we get some news or something about the with respect to quality in manufacturing practices related issues. So raw material manufacturing the process related issues or the quality related issues, again warehousing related challenges, transportation, especially though we are leading in global level. If we see the cold chain supply chain system for the medicine and other transportations, there is a large scope in that area where we can also bridge the gap of availability, accessibility of medicines. And then once the drug reaches the medical shops, again there also we need to think about the, for example, we go to a pharmacy shop is open from morning to evening, and night after 9 o'clock or 10 o'clock they switch off the refrigerator and then go off. So automatically the potency of the drug, again that is questionable. This happens in 90% of the medical shops. So whatever the drug which has to be kept under the cold storage, it potency is questionable. What I want to say is, these kind of areas where the role of technologies, especially the big data analytics, artificial intelligence, or anything which has a large scope, the supply chain, the designing, and even drug manufacturing processes, quality control processes, in all the areas. Again, when we discuss about the patients' availability of medicines, they are also when till the last man or the last patient, we can try to ensure that the drug is reaching to that particular patients. Actually, I thought so many things to discuss, so many challenges, because whatever we are discussing now, it's not a issue of India, it's the global issue. And I also want to urge all the participants. See, there are a lot of government opportunities. For example, each and every government job, which is by the state government or central government, each and every pharmacy graduate is eligible. Whereas we know only drugs inspector or the drug analyst post. Only those are the preferred post by the pharmacy graduates. Leaving that, we need to try, because there are very few technical people or the people with pharmacy knowledge in the civil services or the public service commissions, maybe state PCS also. So there are also lot of employment opportunities. If you are cleared 10th, you are eligible for Group 4 examination. If you are cleared 12th or college degree, you are eligible with a single college degree. You are eligible for all the competitive examination in India. Whereas we never try for that. So that is the one area where we can even focus in the. We can come into public life and we can support and we can provide lot of innovative ideas with respect to pharmacy in India as well as the world. And there are a lot of opportunities in WHO, UNICEF, those kind of even World Bank and all. These kind of international forums also provide a lot of healthcare related services as well as support. They also required the pharmacy people, pharmacy experts to work on. This is also one of the scope which I wanted to share. And then the entrepreneurship. Government is focusing on startup India, stand up India, and then a lot of production linked incentive programs, and then investors, promoting investors, promoting incubation centers and all. Now even when like I'm from like pharmacy background, the role of our pharmacy people who are already there in the industry, they are focusing on incubation, all these kind of entrepreneurship. But the graduates in undergraduation level and post graduation level, we need to think about these kind of things, that we need to go for entrepreneurship, we need to establish for industry, and even without because young minds can come with a lot of technology related solutions for many of the challenges. And especially today, since Mantu Patel ji is here, I also want to emphasize him. And we need to focus on two things in our pharmacy education. One is the technology. I think even now the technology related curriculum is not adequate with respect to pharmacy. And one more area which we need to focus is the out of pocket expenditure. We need to discuss we are already discussing a lot with related to the pharmacy, medicine availability, quality control, manufacturing, all those things. But like we found a new medicine, or we have a lot of medicines, but if we think that medicine, whether that medicine reaches the last the patient who is in need, to ensure that we need to focus on pharmacoeconomics also, because economic concepts can bring in a lot of savings, especially individual patient level. Also pharmacoeconomics can bring down the cost of manufacturing, also cost of supply chain also. So we need to include pharmacy, pharmacoeconomics, as well as these information and technology related areas into the syllabus of pharmacy. I hope you are the better person, or I can say you are the best and the only person who can decide on that. So that is also my urge and request to you. Definitely for our pharmacy profession, we need to think in a global perspective. And with this, I just want to say is, we need to have a broad thinking and thought, and a welfare related approach. We need to make sure that we do work hard, we come up with new medicines, formulations, and lot of every year hundreds of new medicines, molecules, or like formulations are coming out. But if you see whether it reaches the patient matlab, if the patient is not able to buy it, or the patient is if somebody is dying of cancer because he is unaffordable, definitely then all our efforts are going waste. So we need to think in that perspective, because I can say lakhs of people die because of availability, accessibility, and affordability related issues throughout the world. So we need to think in that perspective. And definitely technology, and our today's our theme, the innovation technology are emerging, the digital technologies can solve these kind of issues. And only thing is except a few MNCs or a few leading MNCs in India, as well as the college level, the adaptation and the understanding about the technology is very less, especially in the pharmacy field. So definitely today's conference by Dr. MGR University is an eye-opener. Definitely it is going to benefit the students and the delegates who have attended from various parts of the country. And I congratulate the university, faculty of pharmacy, the principal, and all the organizing committee for organizing such an fantastic international conference. And again, once again, my sincere apologies that I was not able to be present and interact with each one of you. And definitely in a near future, because today and tomorrow it is very difficult for me, but any day after that, in the near future, I will be eager to meet all of you. Maybe in some other these kind of conference or occasions or functions, we'll meet. Definitely we'll share, discuss our knowledge, and we'll think that will bring our pharmacy and health profession to the new heights, adopting the innovation technology. And thank you so much, Principal Sir, and all other the faculty members and the management and administration for inviting me and giving this opportunity to interact and share my views with all the delegates and the speakers and the members of the conference. Thank you so much.